5 causes and 5 symptoms of vulvitis. There are some subjects that are very important for women. Without a doubt, one of these is for their sexual health. And this includes everything that happens around their reproductive organs. In this article, we want to talk about a problem that any woman can experience at any point in their life: vulvitis. What is vulvitis? Vulvitis is an inflammation of the vulva. This isn't a severe disease, but it is a medical problem that results from a series of variable causes. These can include allergies, injuries, external irritation. There are also other vaginal infections that usually come with this inflammation. These include vaginitis or genital herpes. But it's easy to fight this problem with the help of your gynecologist. Causes of vulvitis. Our intimate area is incredibly delicate. There are many factors that can affect it. In the case of vulvar inflammation, there are several reasons that this can happen. The most important are contact dermatitis. Contact dermatitis usually causes burning and itching. But you can be calm because this isn't an infection. This happens when your skin comes into contact with irritating substances and it becomes inflamed. These can be soaps, feminine hygiene products, vaginal douches, condoms, spermicides, scented toilet paper, tampons. Sexually transmitted infections. Herpes, gonorrhea, and chlamydia are 3 diseases that can cause vulvar infections. These diseases usually cause discomfort like itching, burning when urinating, pain, and intense secretion of fluid that can be yellow, green or gray with a strong odor. Vaginal mycosis. Vaginal mycosis is another one of the most common causes of vulvitis. This is an infection caused by yeast that can cause genital itching and a thick vaginal secretion. The yeast infection can be treated very easily with antibiotics. In some cases, over-the-counter yeast treatments are enough. In more severe cases, your gynecologist should prescribe a specialized medication. Bacterial infections. The bacterial flora in your body is beneficial because it helps you to strengthen your immune system. But certain bacteria can multiply excessively and cause vulvitis. This can happen when you use antibiotics. These not only get rid of the bacteria that cause the disease, it also affects your bacterial flora. Among the bacteria that cause vulvitis, there are Streptococcus gardnerella staphylococcus, bacterial vulvitis is accompanied with a white or grayish fluid. This has a characteristic smell of fish. Low levels of estrogen. Levels of this feminine hormone diminish naturally as time goes on. This isn't the common cause. But, some women develop vulvitis as a result of low levels of estrogen. Those who suffer from this problem can show occasional pain in the area and vaginal dryness. Because of this, it's likely that you have some problems during sexual relations. Symptoms of vulvitis. The symptoms that indicate that you are suffering from vulvitis are very diverse. They depend on their cause and include burning, one of the most bothering symptoms of vulvitis is burning. This feeling is more evident when you urinate and after sex. This burning can get worse when it's close to menstruation. Reddening of the vulva area. Reddening in the vulva area is caused by an increase in the blood in the capillary. This symptom is usually accompanied by inflammation and an increased amount of secretions. You'll notice it because the rubbing of clothes or movements when walking will cause a greater discomfort than normal. It's important that you don't scratch or apply any remedy that isn't authorized by your doctor. Painful sexual relations. An activity as pleasant as having sex with your partner can become a real discomfort if you have vulvitis. This happens because the rubbing of the skin can increase your inflammation and redness. If you find that it's too aggressive or quick, you'll feel a deep pain. Pain urinating. Feeling pain, burning, or itching when urinating isn't common nor normal. This can happen when you have problems with your kidneys. But, it can also happen when you suffer from vulvitis. To determine if the latter is the cause, you just need to find out if you have the rest of these symptoms. Irregular flow. The last of the symptoms of vulvitis is the appearance of a different flow than normal. All women have a determined flow. This is part of their body's hygiene mechanisms. This flow is a clear fluid and doesn't have any unpleasant color or smell. Instead, the fluid caused by vulvitis is distinct and comes in larger amounts. Its smell also will change and be a little unpleasant. Visit your gynecologist as soon as you notice these changes. We recommend not falling into the trap of turning to vaginal douches for trying to reduce the characteristics of irregular fluids. Instead, visit your gynecologist so that they can see if the real problem is vulvitis. They can recommend the best treatment depending on the cause and how advanced the condition is. While it's not difficult to treat, you shouldn't self-medicate.